This is Athena Jezik, and today we're going to work on some neck work. I've had a few requests to do a neck piece and to explain a little bit more in detail about what I'm doing. So I'm going to work with that today. Okay. So the first thing is you get your person lying out on the table, and you want to have jewelry removed off of their neck because it's a little hard to work when there's necklaces on, particularly tight necklaces. And what I'm doing here is I'm just giving a stretch and a rotation. You can see possibly I'll show you on this side, my fingers come up alongside the spine and just give kind of a stretching action. It's not anything that's real rough. It's just a gentle move, checking the range of motion, seeing if there's anything going on. What you want to watch for here is that the neck is moving on its own and not being directed by the person on the table. Sometimes they'll help you. That's not really what we want. We want the neck muscles to be completely relaxed so we can get into them. I think I'll use this. So I'm going to use some lotion on her. Sometimes I use a little bit of other stuff. This is actually a little bit better quality than the other one. It's made by somebody locally. I don't know who. I got it from another body worker. Okay, so we've applied the lotion primarily to the back of the neck. And then we can start by just rotating the head to the side and running along this muscle called the sternocleidomastoid. It attaches down here and works up to the there's a mastoid process right there. It's attaching along here. And of course you want to be very careful working the neck not to go too deep. There's veins under there. And there's a lot of nerves. And I'm just going around the neck in every little space so that I'm covering the entire area all the way to the back. And then because of the positional thing, I come back up right along the spine. And then we'll do the same thing on the other side. Rubbing along downward. And as you notice, this side I started from the back, working forward, working front. On the other side, it doesn't really matter which direction you're going to do on that. The neck takes a lot of stress. It holds a lot of stress, so it's important to pay attention to the subtle little movements of the neck, because there's also a lot of ligaments and there's a lot of different directions that the neck moves and rotates. So you're dealing with a number of small muscles and ligaments attaching from bone to bone, all supporting and also allowing for a lot of movement. So it's a little complicated area to work, but it's not anything that's that difficult. Just be familiar with what you're working. And here now I'm going to do a little bit of a cranial hold where I'm going to hold her head up and do an occipital base release. And I'm going to put my fingers in there at the edge of the occipital base there, and my fingers sink in. The ring finger is right next to the vertebrae, not on the vertebrae. And then I'm going to lift her head up and just let this settle in and relax. The direction of my fingers is pointing toward her eyes. And as the head sinks, I follow it back by moving myself forward a little bit into that, following the head. You don't push inward on this and you don't pull when you're doing this, you just let the head rest up there like it's on a pedestal. And you will begin to feel the attachments there soften. And that's a good thing when that happens. It's very, very relaxing. And sometimes if you can't lift the head all the way up where you're balancing the head up, because sometimes heads are heavy, or sometimes people are so tight that you don't really want to take it into that deep of a position. So you can balance your, let's see if I can demonstrate this better. You can balance your fingers, or you can balance the head on the back part of your hand. Kind of, so you're in that position instead of pushing it up and being in that position. So you can still hold it and guide it in the same way as if you were holding it up. Plus, when you hold it all the way up, it takes a bit of finger strength. Okay, so I'm just brushing up again and feeling for every little movement. Now here I'm going to be going in between the vertebrae. This is kind of hard to show you. And I like working from face with the client face up because you just get more range of motion. The other one is very limiting. But I have my fingers on each side of the spine and I'm working kind of in circular motions just to feel the attachments and try to get some of my finger in between the vertebrae a little bit so I can feel exactly what's going on there. And if there's tension there, to stop and hold it for a little while until it lets go, relaxes a little bit. Sometimes you can feel vertebrae that's out of commission, it's twisted or turned. Of course, I'm not trained in aligning any of that, but I do work very diligently at making sure the attachments around it are as soft as possible so that it could align itself if need be, or if the person is getting chiropractic work, that it will go in easier. And then brushing open on the trapezius muscles down here. All kind of attaches. Okay. Another thing that can be done to the neck is adding a little bit of lymphatic drainage because there is some fluid retention going on. And so just to add a little bit of that would be to drain out the interstitial fluid and make the muscle a little easier to work into. And so here I'm just going on the neck chain, and this is just little skin stretching, and that's just on the neck. Okay. Okay, now to work across the top part of the neck is a very delicate area. There's oftentimes a lot of congestion there. There's a hyoid bone that is right underneath the chin. So to place the bottom hand right at the occipital base and then grab a hold very, very, very lightly to the hyoid bone and just interface with it. Don't push yourself in too far at all. Just interface with it and then let the hyoid bone kind of swim around. It'll swim around a little bit, and sometimes you feel the response from the front hand to the back hand. You can feel a relationship going on there. So take the time to feel that. That releases quite a bit. The hyoid bone is quite involved with a lot of structure on it. It's a floater bone. It doesn't have any place on the skeleton that it attaches to. It's protecting the trachea and other parts of the neck, so it's an important little piece, but it also has a lot of muscles that work around it and anchor to it and different things like that. So it's another area that's oftentimes overlooked, but by just doing this, you can unwind quite a bit and release a lot in the muscles of the neck that are more superficial and attaching into that bone. And then to work along the front area of the neck, on top of the thyroid and all of that, you want to be real gentle with that. But you can do a little skin stretching. You don't want to do a lot of rubbing on this one. More skin stretching. They're really not muscular structures, so it's better to do alternative kind of work on them. And when you're real sensitive and you can go like a little deeper than skin deep, you can get an awful lot of change to take place. Okay. The jaw is sometimes affecting into the neck. Sometimes you can get the jaw. Oftentimes I will be working with craniosacral techniques inside of the mouth onto the jaw. There, and her temporal bones now are moving, and that is going to affect into the neck because of the mastoid process and that whole sternocleidomastoid attachment. Okay, some of that seems kind of slow and maybe not too entertaining to watch, but there's a lot of stuff that goes on under the fingers. So those of you who are out there and practicing, you know, take the time to pay attention to that small stuff because it's full of information. And here we're just going to go back to lengthening and taking the neck into some little bit different range of motion. And this is a good range because her chin is able to go over to the shoulder. And if you help somebody's head go over, you don't like force it down or anything like that. You don't want to take their neck out of joint. But you do want to give it a nice full range. And when it feels very fluid, then you know that you've gotten the muscles unlocked. Now there's another technique here that I have developed, and probably other people use it too, but I wasn't ever taught it. I just kind of figured it out, is while I'm rotating the neck, I'm also giving a slight traction. And it's probably more of a traction in the fascial area of the body, right underneath the skin. But by giving a little tiny bit of a traction feeling, it makes the neck rotation sometimes a little easier, and it also feels really good to do it like that. You can bring the head upward. Now again, this is with some traction, pulling the traction out. Don't ever curl the fingers under the head bone and yank. Everything is real gentle. Taking the head up, and then to take it into a little bit of a back arch on the table is just hold it there and let it bring itself back. You want to be careful about backward positions anyway, and do support the head when you take it into the backward position. Okay, I think the neck is pretty well softened. Can come into the trapezius muscles a little bit. And just complete it this way. And around the clavicle, just to give a little feeling of completion. And there we have it. Okay, thank you.